Good morning, everybody, and welcome to our webinar, Are You Providing the Right Mental Health Support for Your Employees? Before we get started, I'd like to run through a couple of housekeeping items to guide you through our webinar today. To the left of your screen, you should see a panel. This is where you can post questions during the webinar, and I'll collate and pose those questions to our experts at the end of the Q&A section. We'll endeavour to answer them all, time permitting. Occasionally, we do experience technical issues, and I apologise for that if it happens. If it does, be assured that the webinar will be available on our website within a few days. We'll mail you when it's available and provide you with a link so that you can view it at a convenient time for you. Similarly, if you do have to leave early, you can watch it afterwards. Okay, on with the webinar and just a few introductions. I'm Eugene Farrell. I'm the Head of Crisis Support Services here at AXA Health Services. With me today, I've got Dr. Mark Winwood, who's the Director of Psychological Services at AXA Health Services, and I've got Dr. Christine Mason, an occupational physician also at AXA Health Services. So just to begin, I just want to talk about a few mental health statistics. A recent study by the Institute of Directors provided the following key findings. Though more than 80% of people believe a good workplace mental health is important, fewer than 1 in 7 IOD members have a formal mental health policy in their workplace, and that leaves about 86% without a formal policy. More than half of IOD members have been approached by staff complaining about poor mental health issues, and the business and impacts that a business might face include poor quality of work, poor decision-making, higher staff turnover, and workplace conflict, also recognised as dangers. And as many of you will already know, 1 in 4 people will experience a mental health problem in any given year. 69% of managers and employees have either experienced or know someone with a mental health condition. So that's a little bit on the statistics. Over to Mark now.
Thanks, Eugene. Let's talk a little bit about mental health now and its implications. Now, let's face it, we all have mental health, just as we all have physical health. But our mental health is an absolute vital component of our overall well-being. And if we are struggling in some way with our mental health, it can have impacts on every single area of our lives. It impacts our ability to learn, our ability to communicate effectively, our ability to have appropriate relationships, to start them, to maintain them, and even to end them. It also impacts our ability to stay physically well. And it can have a very, very detrimental impact on our ability to work effectively and productively. But just as we all have mental health, as I said already, we also have vulnerability to mental health problems, just as we have vulnerability to physical health problems. But in my experience, and this is most certainly backed up with research, we don't, on the whole, treat our mental health with the same level of priority or importance as we do our physical health. But I assure you that just like any physical health problem, the sooner we address that problem, the sooner we address any mental health difficulty we might be experiencing, the less long-term damage will occur. So early identification and early intervention is absolutely key. Despite knowing this, there still appears to be barriers around people getting the help and support that they need. And this is due to all sorts of things, such as misinformation, stigma, and fear. It still very much exists and increases this sort of reticence to ask for help. So we need to encourage everyone to become more aware, so we feel more comfortable to talk about how we're feeling, to recognize when we or our friends or our colleagues in the workplace might be struggling, and to be more open about this very, very normal human vulnerability. I'm often asked, why does stress seem to have increased? Why are we hearing so much more about mental health in the press these days? What's going on? Firstly, it's great that we're becoming more aware of mental well-being, and it's spoken about more, it's talked about a little bit more. We're also becoming increasingly aware of the pressures we're under in modern life and how they contribute to our experience of negative stress, and how chronic stress can exacerbate, kind of make worse, or trigger a more serious mental health problem. Technological advances and changes, as an example, impact the speed in which information becomes available and can make us feel as though we're always on, and that can feel relentless. We might find it increasingly difficult to partition work from our social time and our home life. So, how do you support your workforce to look after themselves and have downtime? What behaviours do you want your managers to model in order to support well-being and give permission for downtime and time off? Societal changes also impact our sense of pressure. We're living longer, which is a great thing. We're having children later and may have responsibilities for caring for children and elderly relatives at the same time, as well as trying to work and manage a personal life. These demands can become and can feel overwhelming. How can the workplace support this and allow for a greater degree of flexibility to allow employees to manage these multiple demands? The World Health Organization predicts that by 2020, mental health problems will constitute the highest disease burden in the developed world. And it's a burden that will be higher than heart disease and higher than cancer. And that's, as you can see from this slide, that's 15%. Just think of the economic consequences of this. How will this impact the profitability of your business, for example? Let's think of the future. What are you doing to equip your future talent to manage the myriad of pressures associated with the modern workplace? Future leaders need to be emotionally aware so they don't only just have the skills to manage themselves in the workplace, but also the confidence to support others. This is a great skill, and we call it emotional intelligence. And it's an integral component when developing a resilient workforce. Being open to discuss mental health might be quite alien to your workplace culture. Maybe a cultural revolution will be required. Think about what you might want to achieve in terms of your business. You know, all journeys, even revolutionary ones, start with one step. What small changes can you make to start this cultural shift? And what components might you think about adding on later, over time, to make the strategic changes that you want to achieve? And who's going to help you to do this? Well, supporting line managers to become more aware of mental well-being so they feel more comfortable and able to promote available support might be a really, really positive first step. Managers are absolutely key to building mental health awareness in your organization, but they also require support in order to achieve this. I'd like to hand over to Eugene now, who will talk to you about some potential changes that you might want to think about making in the workplace.
Thanks for that, Mark. That's some really good stuff. What I want to do is bring it back to the corporate environment. So what can you do to build a robust journey towards mental health? Well, we've created a fairly simple model that's built on 4 pillars: educate, support, manage, and review. And surrounding those pillars are a series of tools. Now, Mark earlier talked about confidence and he talked about openness, and awareness is absolutely essential in achieving that. So creating more awareness on site through training, through wellbeing events, through signposting, there are a number of things that you can do that creates that confidence and that openness to talk more about mental health. Things like psychological first aid training can be really helpful to help your employees, your colleagues understand what mental health is, the signs and symptoms, and how to look out and support their friends and colleagues in this. Wellbeing events So starting off with a well-being strategy and a well-being program, and then building on that as you go through to create not just, as Mark was saying earlier, not just the physical, but also the mental health and well-being, as both of those are interlinked. The employee assistance program is absolutely essential in this journey, something that's proactive, that's well communicated, but also that's used by both employees and managers. And as Mark said earlier, managers are absolutely key. So getting them to understand how to use an EAP and how to refer people in is an essential part of a supportive tool. Crisis management is important, having a plan and something that's practiced and not something that you just make up at the time. So in terms of the recent terrorist events that we've seen, crisis management is a really important thing for many organizations to consider. Private healthcare can support. It's very much one of the tools, something that has inpatient and outpatient cover, psychological cover and psychiatric cover, but it's also linked to things like your EAP and to your occupational health. And good occupational health is really important. And Christine is going to talk a little bit more about that later. But also having good data and using that data, so the metrics are really important. But culture is also a really important thing. Mark, can you explain a little bit more about the culture change?
Absolutely. I think, all of the things you already touched on, Eugene, are so important when it comes to building this overall strategy for mental wellness. But underpinning all of this is culture. And one of the biggest problems that we see when we're trying to shift culture is this concept of stigma, this set of negative assumptions that we carry around about how we might be perceived if it is disclosed that we're struggling with a psychological mental health condition or problem. So chipping away at stigma is absolutely key when it comes to opening up the workplace to normalize mental health as a very, very normal aspect of our lives. And we've created or developed at AXA PPP Healthcare the Be Open campaign to support this. Now, Be Open is an acronym, and it really stands for be consistent in managing employees, but appreciate that some flexibility may be required when dealing with mental health conditions, but don't discriminate. Treat mental health in the same way as you treat physical health when it comes to managing individuals in the workplace that are struggling. E is about ensuring managers, are well equipped to have sometimes quite difficult, quite sensitive conversations with employees, but to build confidence in your management population so they feel comfortable to have these conversations and feel comfortable to signpost employees to some of these great services that Eugene's already talked about. Also, O is to offer everyone within the organization easy access to some of these tools, to the EAP service. You may have online resources and occupational health services. Make sure everyone is aware of them. And that leads into P, which is about promotion. Promote mental health strategies, mental health support, mental health facilities that you have within your organization at every possible opportunity, one-to-one meetings, during team meetings, whenever you possibly can. Educate both your management population and the employee population about the support available. Education is absolutely key. Try and break down some of these myths. And again, it gives this sense of normalization, which leads perfectly to the last letter, which is normalize. To normalize that mental health problems can happen and share experiences. The more comfortable we are sharing our own experience of perhaps difficulties we've had, then actually it really, really helps open up conversations within the whole workforce. Following on from the concept of shifting in culture, I have a quote here from one of our key clients. And the quote is, "It's important for people to talk about it, to feel comfortable to talk about it in the workplace, so that if they feel they have an issue, they can go and talk to their manager or their HR business partner. Also, they feel they are supported and that there are resources and tools available for them to access to help them maintain and proactively build their resilience. And that's from Lee Gallagher at Arup. I'd like to hand back over to Eugene now to talk a little bit more about building a mentally healthy workplace.
Thanks for that, Mark. So I'm going to talk about the pillars just in a little bit more detail. And you'll notice there is overlap in the things that we've been saying, and that's absolutely deliberately designed. So culture is at the center, and the pillars are going to surround that. So supporting healthy lifestyles. As we've been saying earlier, both physical and mental health are important. So health and well-being campaigns, health and well-being in the workplace, they should cover both physical health and mental health. You can provide support around the workplace, such as peer groups. So getting employees to take ownership of peer group supporting, get them talking about their experiences, about the things that have worked for them. This creates a greater sense of openness and of sharing. You can also create mental health champions, and they might be the ones who deliver your psychological first aid training, for example. But also things like flexible working and also how your absence policy is working and managed. And then there's healthcare services acting as support. So EAP, as I said earlier, private medical insurance plan or trust that supports it. And where appropriate, occupational health is an essential part. Let's move on to educate. So we've been talking about this already, promoting mental health, resilience, and removing stigma. So creating more resilience in employees, and as Mark's been saying, removing that barrier, removing that stigma by creating much more conversation about it. So AXA PPP Healthcare's online health centre and our health and wellbeing calendar, they all can play a part in that. The on-site wellbeing events can act as education, they can drive behaviour change, normalisation, as Mark was saying earlier, and creating positive health, both psychologically and physically. The provision of various online support services that can provide information and support to help people understand their issues, understand what's happening with them, and get good information. And of course, signposting to good support services such as your EAP, to healthcare, and to health and wellbeing portals. Provide coaching and advocates. So the Be Open program that Mark talked about earlier, really important. And also coming back to first aid, psychological first aid training, but essentially providing guidance to managers around having those conversations, how to have the water cooler conversation. People are often fearful about asking somebody how they're feeling, but just simply asking someone how they're feeling can be really powerful and be really supportive. So we need to think about that. But we also need to think about things like self-awareness and that emotional intelligence that Mark was talking about earlier. How to deal with difficult conversations and a link to health and wellbeing webinar for line managers. That's available as part of our supports areas. Okay, let's just talk about Manage for a moment. Providing clear policy guidance and support as part of your absence management policy. Look at your EAP services. As I said before, make them very proactive, make them accessible, but also to reinforce the confidential nature of the support so that employees feel confident that they can use the service knowing that it's a fully confidential program. But that very much helps you manage and support. Crisis call, being ready to look after your people in times of crisis should anything happen, so a sudden death or a crisis or terrorist situation, any kind of accident, those are really important too. I've also talked about private healthcare. So look at the cover, look at the outpatient and the inpatient cover and the cover that's provided in terms of psychology and psychiatry. But also think about the pathways. How do they link to other services? Are they able to work together in harmony to create a seamless journey for the individual? And not least of all, occupational health. How that supports managers and employees through referrals and manage and document that process. In worst case scenario, you have long-term disability, and occupational health has a huge part to play in that, in helping employees both getting back to work and also being integrated well into the workplace afterwards. Finally, we've got review. So regular monitoring will provide a picture of how your employee's mental health is being affected as a whole. So things like the absence management data. Also think about measurement of engagement across the various health and wellbeing campaigns and initiatives that you have. How many people joined in? How many people got measured? Where were they from? What departments were they from? Also remember third-party metrics, so management information from all of your programs that you're using, private healthcare, EAP, occupational health, and also health and wellbeing. And also things like employee surveys. So wellness surveys can measure engagement as well as your employee opinion program, if you've got one of those. All of those can act as information to help you review. So that's our model in total. Now, I just want to move on to talk a little bit more about the role of line managers. Critical to the success of any program and how all of these work together is line management. They're closest to colleagues and they can recognize changes. Over 75% of HR managers feel that they don't have the confidence to talk about mental health issues. So you need to help line managers to recognize the signs and symptoms, to support their conversations, and how to communicate, how to feel comfortable in talking about mental health, how to reflect upon their own mental health, and then how to have those conversations themselves so that they can feel that they can do that and they can help others. So that's the model in total, all of it put together and all of the supporting areas. We've spoken about culture and the more tangible tools that you can also use to support your company's mental health strategy, such as I said before, further coaching for line managers and how to signpost into other support areas such as EAP, healthcare, peer support groups, and they can play an important part in providing mental health first aid training. I'm going to hand over to Christine now to talk about some of the occupational health aspects. Christine, over to you.
Thank you, Eugene, for handing over. My name is Dr. Christine Mason, and I'm a consultant occupational health physician who works really to support both employers and employees with work-related health issues. Obviously, this topic is a very large topic, and I could do a whole day focused on this topic. But what I've tried to do today is pick out some of the common issues and topics that arise, and also try to put together some useful resources and information that you may find helpful to look at following the webinar. A question that I'm often asked is, whilst absent, how should the workforce engage with the employee? It can be quite a dilemma for an employer, but we know that keeping in contact is a key factor in helping employees return to work after they've been off, especially with psychological health issues. Contact can be sensitive, as some employees can say they feel pressured to come back to work too early, but without contact, people who are absent can increasingly feel out of touch and undervalued. So how, who, when and why to get in contact? Often employers will have a sickness absence policy and include contact within this, and it's normally a key responsibility of line managers to keep in regular contact with any of their staff who are off work. They will know the person and can handle sensitive issues and often know the background. We would suggest not passing the responsibility to others unless there are particular reasons for doing this. We would suggest perhaps a clearly focused discussion on their health and well-being and return to work, rather than perhaps details of what they're missing or an update. Certainly for minor illnesses, if it's likely that they'll be back at work within the next 7 days, we would suggest that further contact is not really necessary depending on your policy, but a return to work interview at that point can help get people up to speed, discuss issues and set the scene for the return to work. If there is a prolonged likelihood, however, then certainly as much contact as possible can assist to facilitate support. In the following slides, I've got some suggestions on do's and don'ts of the things to consider when creating contact with an employee who's been off and when they're coming back to work. So you'll see on the next slide, I've detailed some suggested do's. Often it's helpful to create a climate of trust by agreeing beforehand the reasons for keeping in contact, and often this is covered in the policy. How, when, how often, and how. For example, a telephone interview or a home visit or whatever is within your policy or whatever feels appropriate for your business. It can be helpful to give managers training on how to approach this sensitively, as often they can be quite concerned about not wanting to make the situation worse and for talking to somebody who can be clearly unwell. It's important, as with anything, to keep a note of the contact made and be flexible. The next point, I think, perhaps seems really obvious, but welcoming your employee back after their absence is very important and can set the whole framework for their return to work plan. Accompanying this with a return to work interview can often help to support and facilitate a return to work and gives your staff the opportunity to discuss any concerns that they have, any issues, any things that they're concerned about work. There's some suggested don'ts on the next slide. We would suggest that any delay in contact can make things more problematic, and waiting until somebody is officially on long-term sickness leave before implementing sickness absence policies, in our experience, tends to delay things. It's important that you never make any assumptions about an employee's situation, or comments such as work is piling off, as often people can be very anxious. Sometimes this happens when people are talking to colleagues at work and their colleagues are perhaps saying how busy things are or how under pressure they're feeling, and this can have a significant impact on somebody who's absent from work with any condition, but in particular psychological health issues. So you've made your contact with the employee and they're approaching a time when they can come back to work. On the next slide, you'll see that I've just detailed some possible support and adjustments that could be possible to aid a return to work. Under the Equality Act legislation, there is a requirement for an employer to consider reasonable adjustments. Workplace adjustments can be temporary or provided on a permanent basis, and really they can be quite individual, especially with psychological ill health issues. A phased return to work can be very effective, as it just allows an individual to build up their resilience and their working hours tolerance. Sometimes an individual can experience some side effects from medication, so they're better starting work a little bit later if they're feeling a little bit drowsy or if their symptoms are worse in the morning. If they've got any treatment planned, any ongoing counselling, it can be helpful to build in flexibility within their schedule to attend such appointments. Obviously, what is a reasonable adjustment is ultimately a business decision and will depend upon what is available. Other sorts of adjustments, and I've tried to tailor these really specifically to mental health, is thinking about any additional training requirements, modifying instructions or reference manuals if they need support with this, looking at work patterns and shifts, trying to look at reducing travel if this is a cause of anxiety for an individual, thinking about a buddy, additional supervision, or alternative duties, perhaps a temporary project-type work as a way of reintroducing somebody to the workplace and increasing their support. These are just a few of the types of adjustments that we might consider, but obviously there could be different ones, and it all can depend on the individual circumstances. So moving on to the next slide, I thought it would be quite helpful to signpost some useful resources that you might find beneficial. The next three slides really just list these for you, but they've all got a useful focus and a different type of focus. So the SHIFT initiative, for example, is a campaign aiming to create a society where people with mental health problems have the same rights and opportunities. And there's a specific link for employers, and there's a line manager's resource practical guide. For example, there's a section on identifying the warning signs and talking at an early stage, with useful information on engaging with someone who's finding it difficult to talk about their mental health symptoms or whether they're not feeling well. CIPD has worked with the Health and Safety Executive and Investors in People on a project to develop practical help for HR and line managers to tackle the issue of stress at work. This includes some competency frameworks for line managers to work on the skills required to reduce and prevent stress at work. So that can be quite a useful toolkit. The next one listed, Employers Forum on Disability. So this is an employers organisation focused on disability as it can affect business, and there's a particular link to the Line Manager's Guide called the Attendance Management and Disability Booklet, which may be helpful for looking at trigger points and tips when dealing with an employee with the matter of sickness absence. There is also an official government website for businesses of all sizes with free business advice and support service, and that's the link I've provided there called Business Link. How to Deal with Stress is one particular resource that they have that may be of benefit. The Institute of Occupational Health and Safety has an occupational health one-stop shop site for health and safety professionals with guidance, fact sheets, case studies and other issues. There's a toolkit module on stress which has a section on early intervention. The Shaw Trust has a website which includes a checklist when discussing employees' mental health conditions, and there's some practical suggestions about how to go about this. You'll also see that I've listed the Mental Health Foundation on this slide and included a booklet entitled What Works for You. This is really knowing how to support a colleague who is, for example, experiencing a difficult period. Knowing how to support a colleague can make a huge difference to how they feel and how they cope. And lastly, a very recent resource is Public Health England has joined with Business in the Community and the Samaritans to produce another specific toolkit, specifically looking at suicide. We would hope that we never encounter this within our workplace, but sadly these things can happen, and having a crisis management plan and a post-intervention toolkit and a mental health toolkit can be extremely beneficial. So I've hoped to cover off really some practical questions about when and how to engage with an employee, and some practical sources of support and some practical links for you to utilise. I will hand back to Eugene to move forward to the next part of the presentation.
Thanks, Christine. There's some really important points there. Okay, before we move into questions, I just want to wrap this up, just bringing the whole thing together. A program like this is ever evolving. It isn't just fixed. It isn't something that you do now and then don't look at again. It's a constant cycle of review, re-implementation, implementation, but also don't do everything all at once. It's a good idea to start small, make some changes, and then build over time. Use your knowledge that you gain from doing this, use the insights that you gain, and use those waypoints of review to look at things and then to refine and ensure that your organization has the right tool to help its workforce. Okay, let's have a look at some questions. And the first one is that we've spoken about managing conversations but not provided examples. What are the key points in managing this type of conversation? Well, firstly, I'd like to point you towards a resource that we have on a previous webinar where Mark talked about managing difficult conversations. So we've got a whole webinar that you could look to on that, which will help it in that. And the conversations really tend to be, I guess, what we'd call the cooler, the water cooler moment conversation. So it's that whole thing about being confident enough to say to somebody, how are you, or how are you doing, or are you okay? And just letting the conversation naturally lead from that, and not being afraid to take that conversation with it. So it's that thing about being very confident to understand that what comes back, it's not scary, it's not difficult, it's just sitting and having a good conversation and understanding why somebody is the way they is, what's going on with them, and then looking at the kind of supports that you might be able to offer. So not complicated. We never try and make this sound complicated or difficult, but there's certainly an easy way of doing that. So have a look at the webinar, and I'm going to mention a couple of resources in a few minutes later as well that you might want to follow up on. So we've got another question, which is, what are the key differences between EAP and crisis management, and how and where does crisis management fit into a mental health strategy, and what part does it play? Well, EAP is very much part of crisis management, so it's one of the tools that we'd use during a crisis management situation or a critical incident. However, the crisis management support that's provided from EAP providers and people like ourselves is very different. So that's really dedicated to a specific situation. So that might be something like a critical incident such as train, rail crash, plane crash, a terrorist incident, and indeed sudden death. So we see a lot of examples where there's been a suicide of a colleague. Very rarely it happens in the workplace, but it's something that's happened to a colleague away from the workplace. And often for a lot of people, then they're in a situation where they're feeling very uneasy about what happened. They're in a state of shock. People start to think about, should I have seen the signs? Should I have not seen the signs? What more could I have done? And the crisis management support that can be provided tends to be a group psychoeducation support, usually on site, usually in groups, and it's typically arranged usually a day or a couple of days after the particular incident has happened, and that even applies to kind of terrorist incidents, etc. as well. So crisis support, critical incident support are very different and very individual, and it's a very specialised area. In very large incidents, then we can build in lots of other supports. So that might be supporting the family, or it might be supporting with treatment afterwards. And again, we've done a webinar on crisis support. So look back over our previous webinars, and I ran one particularly on that myself, just I think last year at some point. Another question: are there any programs that we can use as inspiration for this? Actually, there's loads and loads of really good supports and programs out there. You might want to have a look at the Mind Mental Health Index, for example. That might help you in terms of looking at your own workplace and where you are. That's really good. I think all the materials from Mind are really excellent. Princes Harry, William, and Catherine have got together, and they've got a program called Heads Together. There's some really nice little video vignettes on there that you might want to have a look at. So they've got a lot of mental health resources and a lot of follow-up, and they're very active in promotion of mental health and doing all sorts of runs and marathons and all that sort of stuff. But they've got some really good resources, so I would have a look at those as well. There's the Mentally Healthy Workplace. That's a good thing for organisations to have a look at, and that's about how you do things in and around the workplace. BITC, I think, have got some great materials as well. And probably one of my favourites is the Time to Change programme. That, I think, has got fantastic support materials, all the stuff that we've been talking about. And actually, if you participate in Time to Change, you can very much get involved in changing the whole culture of the organisation, as we were talking about earlier. So I would definitely have a look at all of those. Next question that's come in, can we have the OH resources that Christine referred to? Yep, we're going to make those available to you, and it will be in the follow-up email that we're going to send to you after this webinar, and I'll just mention that a little bit later. And we're running out of time, so I'm going to do one more question for you. I agree with your comments that line managers are key. What level of training do you recommend for line managers? For example, would you ideally see them attend mental health first aid and be trained as mental health first aiders, or reserve that training for champions and train line managers more generally in raising awareness to enable them to have the conversations with their employees? That's a really good question, and I guess we could have covered that off in a little bit more detail, but let me just comment on that. Absolutely great for line managers to attend mental health first aid and get that sort of level of knowledge. That should be absolutely kind of base level of knowledge for line managers. But I think in having those more complex conversations and just understanding a little bit more, then I'd recommend a more dedicated line manager training program. So something for line managers that looks at how they can have those conversations. If you're still feeling not comfortable about those conversations or where to go with them, then awareness of mental health is fine, but you can certainly upskill the line managers in those soft skills of having those conversations or where to go with them. Not all line managers are going to feel comfortable having those conversations, and not everybody's even experienced that in the past. So it's definitely worth investing in some additional training for line managers. One of the things that we've also done a few times now is take it right to the top, where we get in and we do some awareness and some training with very senior people from the organisation. So that's really part about getting them very aware, and also part of that cultural change. So it's aimed at a different level. It's covering different things, and some of the times what we've experienced is, one of the very senior managers in the organisation has had an issue either themselves or within the family, and then they're able to use that and talk about that with their colleagues. So it can work at all different levels. So it's definitely worth having a look at all of those. If you're interested in any of those sort of things, then please do contact us or your account manager, and we're happy to talk about how we can set up some of those trainings for you in and around the workplace. So that's all the time that we have today. Please do send in any more questions, and we'll respond to you individually with any of those directly to you, and we'll post all of the answers to questions, etc. We will send a follow-up email with a link to the webinar. So if you've missed a bit or you did freeze up, and I saw that one or two of you had a few IT issues, then you can follow up on that. I recommend that you maybe put that forward to some colleagues. We know that, for example, things like HR teams or teams within organisations have used the webinars as part of their kind of training or in their monthly meetings, etc. So it's available to do that. And lastly, it just remains for me to say a really big thank you for joining us today. We really do appreciate you joining us and taking the time out from what is a busy work schedule for all of us. And thank you, and have a really great day.